Perfect. And that is a little warning to everyone that this is being recorded. My name is Crystal Rodriguez. I'm the chair of the Riveters Collective's Justice System Committee. Thanks for joining us tonight for the new police reform laws webinar. We're here tonight to learn more about the new police accountability laws from the 2021 legislative session. We'll primarily focus on 5 laws that went into effect in July. These have received quite a bit of pushback from law enforcement agencies across the state, including within our county. And we believe this pushback has created a lot of confusion about what the police can and cannot do. Even news reporting about it has created some confusion. So we want to understand how these new laws will affect the work of policymakers, behavioral health specialists, and law enforcement officers. We want to know, will people, especially people that identify as BIPOC or are marginalized, be safer because of these new laws? Tonight, we'll hear from legislators who were directly involved in passing these new laws, and we'll also hear from policy stakeholders that work within Whatcom County. Following the panelist presentations, we'll do some Q&A, so feel free to drop any questions you have in that area of the webinar. And also there's area for some live chat if you're interested in having a side conversation. And we will be finishing up, hopefully, I'm not sure if she's arrived yet, but from an impacted family member working hard to improve police policies and get some insight on what to watch for during the next legislative session. And before we get started with our panelists, I'd like to mention that the Riveters Collective honors the people of the Salish Sea with gratitude and acknowledges with humility that the Salish Sea Basin, San Juan Islands, and the North Cascades watershed have been their territory since time immemorial. We give our deepest respect and appreciation to the Lummi Nation and Nooksack tribe for their longstanding care and protection of these lands and waters. Riveters Collective commits to initiating and growing partnerships with the Nooksack tribe and Lummi Nation. We will work toward goals that honor and center their work, descendants, and culture. So we will we'll get started on our panel tonight. We're starting off with Representative Alex Rommel. He's my representative, actually, so I'm excited to be here with him tonight. He represents the 40th District, which covers a fair amount of Bellingham and Mount Vernon. He's a leader on environmental work and addressing climate change, and is also currently working to improve the state's tax code. Representative Rommel, you're going to be giving us an overview of the 5 bills that we're trying to highlight tonight. So the floor is yours. Thank you.
Thanks, Crystal. I really appreciate your work on this and the Riveters Collective's, your partners' efforts in bringing us all together. Looking forward to this discussion. Thank you for initiating it. So I thought I'd just kind of level set a little bit with a reminder of kind of how, I'm not quite sure it started, but I think sort of how things got to where we were at the beginning of this last legislative session. And it's really the historic civil rights moment that occurred last summer. It's unlike anything I've ever experienced in my life. I don't know, I'm not historian enough to say sort of what it is about the particulars of the murder of George Floyd that created that moment, but it was powerful in our community, in communities across Washington State and across the country. Calls for justice and change in the criminal justice system were powerful, and they're deafening. And speaking for myself, and I think for a lot of other elected officials, really felt a heartfelt call that we needed to do something, we needed to act. Because it seems very clear that trust with the community had been broken too many times, too visibly, too often. I think that good policing relies on a trust and relationship with the community, and that in many places that trust and that relationship wasn't working. And our responsibility was to figure out how to fix it. So I really want to acknowledge the work of Rep. Goodman and Rep. Lovick and others. We'll hear from them in a moment with a lot more of the particulars. They've worked together over the fall and winter to pull together a package of legislation to meet this moment and respond to those challenges. I don't serve on the Public Safety Committee, and that means that other people were doing the lion's share of the work on these bills. I was proud to sign on as a co-sponsor, which really means indicating that I think it's a priority and that we need to work on it. So throughout the course of the legislative session, we heard a lot of feedback on these bills. In retrospect, we're sort of hearing, well, I'm not sure our voice was heard. The truth is clear in my mind that we heard a lot of feedback from law enforcement throughout that process. At one occasion, I got a message from police chief in Burlington and passed that information along, and the change was made to the police tactics bill within the week. So I'm proud of the work that we did this last year and that response to that historic civil rights moment. So since this session, as you indicated, we've heard quite a bit of concern and sort of questions about some of the different aspects of these bills. We spent a lot of time walking around and checking in with different police departments and service providers to try and understand what those impacts and what those concerns are. Thanks again to Rep. Goodman, who came up and visited with us to check in on that. And that's been a team effort of all the legislators in the region. And so in my mind, there's kind of three categories of these sort of concerns. And I'll just give a quick example of what each one of those looks like. I think the first is just a disagreement about what the policy ought to be and some resistance to change. And so, you know, in response to a Supreme Court decision this last year, we passed a bill that had the effect of changing what had been felony possession of controlled substances, drugs, to a simple misdemeanor. There are some law enforcement officers that we've heard from who deeply disagree with that policy. My own position is that the drug war has been a failure. It hasn't had the intended effect, but it's difficult. Sometimes it's been in effect for so long, it's difficult, I think, for us to sort of imagine what change could or should be. And so there's just going to be some resistance to that change, and I think we need to work through that. The second category of challenges we're hearing about is places where I think we missed unintended consequences of the way that the bill was drafted. I think the intent might be clear, but some of the language needs to be corrected, and I think we intend to correct that. So an example I would give of that is in the police tactics bill, we said that the police departments should not be authorized to purchase or use militarized equipment. One of the things on that list of militarized equipment is 50 caliber ammunition. In my mind, that's bullets. But it's subsequent to the passage of that bill, it's been interpreted that in some cases that would include less lethal guns that fire a beanbag. We want police departments to use those less lethal alternatives. And so I think we need to correct that. Whatcom County has said we're not going to be able to use those until that fix is made. The Whatcom County Sheriff's Department. Bellingham Police Department has interpreted that differently. That unclarity, we should fix that. So we have some of those cases to work on. And then the third category, I think, is where there's a misunderstanding that is sort of reverberating in a way that's creating confusion. And I think we just need to sort of sort through that confusion. So I'll give an example. The House Bill 1310 limits the circumstances under which police department can use, under which police officers can use force. And there has been confusion about whether that means that police officers can even respond in certain kinds of circumstances. And so actually Rep. Goodman and I were talking with one of the sheriffs in another part of my district, not in Whatcom County, but about whether or not how they were responding in these cases. And I thought I had understood from him that the intention there was that those officers were absolutely going to respond to mental health, behavioral health crises calls, where people probably don't need to be taken to jail, but they maybe need some help, and bystanders or people around them are concerned. Turns out the next week I got a call from somebody in that area who said family members in crisis, has been committed to involuntary treatment, and we ought to be able to, but the police department has said, we can't respond to this call, we can't even go, and we won't help. And if you don't like it, you should call your legislator. And that's obviously not a great call to receive. And it's clearly somebody whose family was in crisis. And I reached out to the sheriff, and when I did get through to him, what he told me was that, yeah, there's some more details to this circumstance. This person was not a threat to themselves. We assessed it. We did go. He had barricaded himself in his house. He wasn't a threat to anybody else. And if we had tried to go in to help him, we would have created a more dangerous circumstance. And in that situation, we wouldn't have gone with or without House Bill 1310. And so perhaps the individual deputies responding in that circumstance didn't get that part of the message. And so they interpreted the result there as being related to these bills, even though it wasn't. And so in those kinds of cases, we have just some work to do to make sure that those instructions get all the way through the chain of command and to the whole community. So that's the work that's in front of us. And so I'm looking forward to this discussion and sort of figuring out how we can continue to try and work out those details. My question is always going to be, for each of these problems or challenges that we identify, which of those buckets does it fit into? So thanks again, looking forward to the conversation.
Thank you, Representative Rommel. That was a perfect summary of what we're hearing by reading news articles and what we've been hearing. Next up, we have Representative Roger Goodman. He represents the 45th District, which covers Kirkland. He's an attorney and the chair of the House Public Safety Committee, so is very closely working on all of these new laws. He is responsible for assembling the policing policy leadership team to work with the BIPOC community for comprehensive reform. That name of that team has been very difficult for me to say, but I got it out. So we've asked him to describe the intent and rationale of some of these key reform legislations. And Representative Goodman, if you could please explain how is it that these bills were supported by the Washington Fraternal Order of Police and then received so much resistance once they were passed? That's one question that we've been having.
Well, thank you very much, Crystal, and good evening, everyone. It's a pleasure to be with you. In the wake of the protests in the streets nationwide after the murder of George Floyd, I paused a bit and I said, well, Washington State is different. We don't have a problem here so much because we already actually had enacted Initiative 940 just a couple of years before, which would hold accountable police for the use of deadly force. And in that process, we brought together police and the communities they serve to agree on the language of Initiative 940. And it was a great celebration. Those relationships have sustained themselves, a little bit strained, and yet form the foundation for the work that we did. But what I saw in the response by police to, particularly in the city of Seattle, to the protests was, it sort of looked like demonstrations against police brutality were met with police brutality. So I thought again and realized there's a lot of unfinished business, even here in Washington. And we had to take up the charge of moving legislation through to hold police accountable for misconduct, and to improve their training and to give a voice, particularly to marginalized communities, to uphold the policing profession, just to do what we could to continue to improve the relationship between police and the community. Bear in mind that the vast majority of police officers are dedicated, well-meaning, doing the best they can with a very difficult job. We are not the ones who run into the danger, they do it for us. And so it takes quite a bit of character to go into that profession. So the policing policy leadership team I pulled together by reaching out in the House of Representatives to the members of color and the Black members. We have more and more diversity in our caucus. It's very refreshing to see that in the Democratic caucus in the House, they reflect the diversity of the districts that they serve. And it really is not my time. It was not Representative Rammel's time as white men. It was, although I am the chair of the committee and I have a command of the subject matter and I know the players, and I've been around for more than 15 years now in the legislature. I managed the process, but really from behind the scenes, while the Black members stepped forward and they were the voices and faces, drivers, champions of this reform. We passed 13 bills, a wide range of legislation, remarkable, a comprehensive package of police accountability reforms in one session. Normally it takes a lot longer than that in a legislative session or a succession of sessions. But because we focused on social equity, racial justice in this legislative session, we really were able to be very disciplined and get it done. We passed a bill on tactics, 1054, which bans or severely restricts a number of questionable tactics such as chokeholds and other neck restraints, and the use of military equipment, as Rep. Rammel was talking about, vehicle pursuits, which can endanger the community in general, shooting at moving vehicles, these no-knock warrants where police do not even have to announce themselves, and those have resulted in unfortunate deaths and injuries. And so that was a very important keystone piece of legislation in this package. 1310, again, was another one, establishing for the very first time a uniform statewide standard for the use of force. We have now circumscribed when force may be used and when it may not be used and how. The focus is on de-escalation, where force is really the last option. And we restricted the use of force to really only when it is absolutely necessary. We also enacted a bill to create a new state office of independent investigations so that if there is a use of deadly force, a serious incident, that the investigation is independent of certainly the agency that was involved, and even further independent from police themselves, although they contribute to the process, they're not the decision makers. And so that was also important to help establish trust between police and the community, that investigations would be done independently. We also, I'm just going to go over a few other bills that were part of this package because I want to sort of describe the broad scope. We've heard some questions about ambiguities and some accusations that what we did was flawed and rushed. And in fact, if you take a look at all 13 bills, we really only come down to about 3 or 4 issues. So we actually did quite well. When you pass a comprehensive package like this, inevitably there are going to be some refinements and some clarifications in the subsequent legislative session. So we're planning for that in 2022. But in general, most of the bills we passed are in good shape and set good policy in place, such as giving juveniles the right to consult with an attorney when they're stopped by the police. Juveniles are not necessarily as familiar with and are intimidated by the justice system. And we're going to ask police to pause before they interrogate them so that they have a chance to talk to a lawyer. This is an unwaivable right that we've given to young people. Literally give them a phone and they will be able to talk to lawyers on call if ever they're coming into contact with the police. We also are going to require the recording of all interrogations. When police are interrogating those who have been arrested, it's sort of been a black box. We didn't know what was going on. A number of false confessions or forced confessions or misinformation have led to wrongful convictions. And so we want that transparency, and the police very much supported that. There's some question about the technology necessary to record these interrogations. And we are moving along. Eventually, everyone's going to have body cameras, but that particular technology is not necessary here because the place of interrogation is usually most in a place of custody like jail or the police station. We also cleaned up what's called the Brady list. The law enforcement who engage in misconduct are on a list called the Brady list, which allows them to be impeached as unreliable witnesses on the stand because of their having been untruthful in the past. No police officer wants to be on the Brady list, and yet statewide there wasn't a consistency in how the process went forward in putting officers on and taking officers off the Brady list. So that was an important, again, consistent standard statewide. One of the most important bills we passed was strengthening the state's ability to decertify officers who engage in misconduct. Sometimes officers will perhaps use excessive force or engage in verbal abuse, or there'll be racial bias, a number of different aspects of misconduct, and not really be sanctioned or disciplined for it on the local level in the local police agency. Usually they are, but we wanted to create a backstop on the state level so that the Criminal Justice Training Commission, would be able to investigate, hold hearings, and sanction officers for which it would be appropriate, and not necessarily completely decertifying them, taking their license away, but suspending them for a period of time, requiring mandatory training, probation, and that sort of graduated sanctions that we're allowing. And so currently the Criminal Justice Training Commission has about 30 or 35 cases like this. And if you take a look at the details, and I have, those individuals ought not to be in the profession. Bear in mind, there are 11,000 police officers in our state. So 30 to 35 is a very small number. And yet those officers really ruin it for everybody. So there are officers who really ought not to be in the profession and should have their license taken away. And we're strengthening the state's ability to do that. We also created a new affirmative duty for officers to report the misconduct of others, and also to intervene when they witness excessive force being used by other officers. The old time, it was officers sort of protecting one another, the thin blue line. Now this flips the frame and has officers holding up the profession by reporting the misconduct of others, and really improving, again, confidence of the community and the police, and confidence of police in one another. Without transparency, we don't have accountability. And so I'll just comment on the last piece. There are other bills too. We can go on forever, but we are going to be developing publicly facing databases so that any member of the public or the media will be able to log on and find out interactions between police and members of the community, who is getting stopped, who is getting searched, who is getting arrested, and who is having force used upon them, and in quite great detail, a lot of information. And that will be actually a diagnostic tool for police agencies to reform their practices. They very much supported this legislation. Unfortunately, we might very well see that those who are being stopped and searched and arrested and having force used upon them are disproportionately people of color and people in poverty. And so it'll help both the community and police be more fair and more effective, and again, improve the confidence and the trust between the community and the police. So I'll stop there because, again, I could go on forever. It took us 9 months to come up with this package. The policing policy leadership team had many, many meetings with youth groups and with scholars, nationally recognized researchers, with every police group, all of the police unions, the sheriffs and the police chiefs, and many other groups. And throughout the legislative process, in the session, everyone was at the table. We went line by line over these bills. I had 7 in the morning meetings almost every morning, most often with the police unions, to make sure, not necessarily that we were going to agree, but that we knew what their concerns were. And so now we have a few more issues that we need to iron out. And in the next 2-3 months, I will be convening all the interested parties to figure out how we can clarify and refine these laws, because the police need certainty, and we will provide that for them. And right now we're in this interim period where there's a little bit of concern, but in the end, we are listening and we will address those concerns.
Thank you, Representative Goodman. That was a really great summary of many of the news laws that were passed this last legislative session. We do need to get moving on. I am notorious for being a little bit behind schedule. We do want to hear from Representative John Levick. He represents the 44th District, which is the Mill Creek Snohomish area, and a proud representative of that. He's got an interesting background, especially for this topic. He's a former trooper, former Snohomish sheriff and executive. He's the House Pro Tem Speaker. And this one's my favorite. In 2020, he was voted Legislator of the Year by the Washington Fraternal Order of Police, which shows that he really has good rapport with, he's a great liaison, and he's got a good rapport with the law enforcement. Representative Levick, if you could please explain from your unique perspective as a legislator and former law enforcement officer, why are police accountability and publicly accessible police data systems important? And we just got a little bit of touch on that whole data aspect. I couldn't agree more, but would love to hear from you.
I'll just start by thanking you for letting me follow Representative Goodman and Representative Rammel. They are just two exceptional people. Roger's probably one of my dearest friends in this world, and Representative Rammel is just right next to him. So let me just say that accountability is everything. But I always like to start by telling people that nothing good comes from a pandemic. Nothing good comes from social unrest. Nothing good comes from what we have all seen the last year. And obviously nothing good comes from what we saw with the murder of George Floyd. But the only thing that's good that came from it for me was that I've had a lot of time to do a lot of reading. And I was just reading, and I'll share a quote with you by James Baldwin, when he said, "Not everything that is faced can be changed, but nothing can be changed without being faced." Now that kind of says it all for me. And I'm going to just share another quick quote with you. So we select from the human race, and the human race is flawed. Whether it's the clergy, teaching, media, people fail. Unfortunately, when a police officer fails, it is spectacular. That quote came from a gentleman by the name of Charlie Beck. He is the retired chief of the Los Angeles Police Department, and my son is with the Los Angeles Police Department. He shared it with me, and when I rode with him, he keeps it in his car. I will just underscore something that Representative Goodman said, and I believe this in my heart. I always tell people that I'm Black, I'm brown, and I'm blue. You notice I'm wearing a blue suit. I hope you guys like the blue suit. I love blue suits. But the reason I tell people that I'm blue is because I wore the blue uniform, proudly wore the blue uniform for 31 years as a state trooper. And I can tell you this, that 99.9% of those brave men and women, like Representative Goodman said, go to work every day and they do their job, and they do their job to the best of their ability. Those aren't the people that we're concerned with. We are concerned with the ones that don't. And I can honestly tell you that I have seen things in my career, I saw things in my career that today make me sick. And I can promise you that there are days that I can't sleep right now. There are still days that I will go to bed and I will still see the bulging eyes of George Floyd with the knee on his neck, and where the knee was on his neck longer than both Representative Goodman and Representative Ramos spoke together. So nothing good comes from all of these things, but what the good that's going to come from it is that we are bringing the community together. And I tell people this all the time. You know, we might not necessarily be friends, but we don't need to be enemies. And I think the fact that we are sitting down and talking with each other and having these kind of exchanges will change a lot of things. You know, people hate change. I tell people this all the time. People hate change and they hate the way things are, but things could not remain the way they were. I will say this and I'll say it again. 99.9% of those brave men and women go out there every day. Hopefully I was one of them. I see them every day. I'm from a law enforcement family. We almost call it the family business because there are so many of us in the profession. They go out there every day and they do their job, but it's the ones that don't. And I had a few other things that I was going to say, and I think Representative Goodman summarized it quite well. We were working on this last year. We did a lot of great work, and of all the things that we did, what we're hearing about are about 3 or 4 things, like something about pursuits and other things. We're going to correct those things. But I'm going to end with just one quote that a lady by the name of Monisha said as she came in front of the Law and Justice Committee at the start of this year. She said that the year 2020 gave us perfect vision. It clearly showed us many of the inequities that exist in our society. I don't think it could have been said any better. I think that I heard Representative Goodman talk about things. When I look at things like the State Patrol, an agency that I was so very, very proud to serve with, still stopping and searching people of color at a higher rate than there are other people. Those are the things that we need legislation to address those things. And that's why we do the work that we do. So with that, I know I didn't use 5 minutes and I'm going to give you some time back, and I look forward to any other questions you might have. But the good part about it is I drew the short straw, so the other guys covered everything I wanted to cover.
Oh, I love it. Thank you. I appreciate your sense of humor. Thanks for your input. I think your perspective is really needed in this conversation as having that dual role in creating these new laws. We did have one question come in that I think maybe can be covered real quick. Hopefully really quickly. Why were the bills implemented in July of this year when the model practices being developed by the state attorney general are still being drafted? What was the reason we didn't, well, the other way around?
I probably, Rep. Goodman, being with this legal background, will know more about that. The bills have to become law a certain period of time after they're passed. And I think my sense is that it just takes time to draft these model policies. I could be wrong about that. Is that what it is, Rep. Goodman?
Well,
if we could keep it a little bit short, that'd be great.
Yeah, it's unusual. It's unusual for politicians to admit they might have done something wrong these days. But I will acknowledge that we have put the law in place before policies have been developed pursuant to the law. And so it's arguably cart before the horse. The policies about the use of force are supposed to come out of the Attorney General's office in the next July. And yet now we still have a new law in place that force may or may not be used in a number of circumstances. We have a whole new scheme. And so there is some confusion, department by department, jurisdiction by jurisdiction. And so that is one of the issues that we've created by not perhaps having a delayed effective date of these laws, putting the statute in place after the policies were developed. However, we have learned a lot in the last few months because of the police response. And so we might actually refine these laws more than we would have otherwise in the upcoming session to comport with the policies that will be in place.
Okay, thank you. Thank you for responding to that. And I see someone's got their hand up. We are taking questions within the Q&A section. we don't have any plans or the time to have the questions, thank you, be live. We will definitely be trying to incorporate as many questions as we can tonight, and it'll definitely depend on how quickly we get through the panelist presentations, which I think are really important. Next up, we'll be hearing from Council Member Holly Huffman. She is a council member for the City of Bellingham. She's also a Bellingham business owner, so we thought her perspective was definitely needed here tonight. On the council, she's on the Safety, Health, and Justice Committee, and she's been quoted as saying that she wishes to decrease incarceration while increasing prevention and alternatives to the traditional justice system. So Council Member Huffman, question for you to get the conversation going. What do you anticipate will be the impact of police reform legislation on local policies and businesses?
Sure. First of all, thank you for having me on this panel, and thank you to our state legislators. This is an incredible slate of legislation. What a huge amount of work. And so I really appreciate all of the work that's gone into this. You know, and as far as, can you repeat the question, please, Crystal? It just blanked.
Yeah, oh good, I'm glad that doesn't just happen to me. I've got lots of pieces of paper in front of me. What do you anticipate will be the impact of police reform legislation on local policies and businesses?
Oh, sure. Okay, so pretty broad, which is great. I want to keep it fairly short and get to the other presenters, but from the slate of legislation that's been passed, it turns out from my discussions that there hasn't been a significant impact. In fact, some of this stuff is already stuff that we're doing, which is wonderful. And then there will even be representatives from our area that will be consulting further to implement some of these things, like the SB 5259 requiring reporting, collecting, and publishing of information about law enforcement use of force, something that we're already doing. I guess it's in fact more than is required. So a lot of this isn't going to have a big impact. I think when it comes to a little bit of scrambling, it has just been the people power to help implement some of this in the best way possible. So it's my understanding that, for example, law enforcement calls that have a behavioral health element are taking quite a bit longer than they would have otherwise. Probably longer and being done in a better way, but taking a lot longer, and not necessarily having a mental health professional along for the ride, which we hope will be something that's happening shortly, is just leading to a lot more time. Something that might have taken an hour is now taking 4 hours. And so, and then figuring out how we implement some kind of behavioral health crisis response to help kind of fill those holes of adequate response has been a question. Luckily, we've been working on that question for about a year now. We started the process of looking into what an alternative response team would look like about a year ago. And so we're a little bit ahead of where maybe other communities are, but and one of the biggest challenges in that is, again, finding people who are skilled in that sort of work and who are willing to do that kind of work across the region. And maybe more, we'll talk a little bit about this as well, but people who have expertise in behavioral health are a little bit harder to find. People just aren't going into that field for a variety of reasons. Could be pay, could be stress, and so attracting more folks into that profession is I think something people are pretty committed to working on right now, problem solving in that area. But we won't have the people right now. We need them right now. I think there are something I heard quoted 100 positions open in our region right now for that sort of work. So so that, I think, is kind of the big challenge that is solvable, and we wish we had we wish we had those people now, but it's going to take a little bit of time to really implement that. And, you know, some of the other things is just fine tuning, as Representative Ramel mentioned. For example, the 50 millimeter caliber weapons that shoot beanbags. You know, another one that I thought was interesting that came up was regarding SB 5476, relating to the Blake decision, and if drug possession isn't a felony anymore, what happens when a police officer finds heroin on somebody? Do they let them keep it, or do they confiscate it? I think that's been a little unclear. And then there isn't yet a statewide database when it comes to so with this law, a person is required to have been offered diversion services twice before they can be prosecuted. And so, but there's no way to know if, for example, somebody has been offered diversion services twice in Seattle, but then they're in Bellingham. So a statewide database apparently would be really helpful for that sort of a thing. So like just the fine tuning stuff, I think that the former speakers have mentioned, which I think is a great sign. And I'm really happy to hear that law enforcement officers and representatives are engaged in those conversations, and that's been really productive. So yeah, that's about all that I have.
Can I just hop in for 10 seconds? I know I left about 3 minutes on the board, and I'm going back for that time right now. I'm just kidding. So, you know, listening to her, I will tell you something that I've noticed. Representative Goodman and I have gone out and met with a lot of the police leaders, the police chiefs. I will be meeting with my sheriff here next week. And I will tell you this, a lot of the things a lot of the legislation we passed and the implementation of them and the things that will go on, it's going to come down to leadership. I will walk into the room, whether we're in Starbucks or a coffee shop, and you can just almost tell instantly if it's the leader that's going to get this done. These young men and women in law enforcement, in the profession, are looking for leaders. And I go to the academy, I've gone back probably 4 or 5 times now, and I see these new young recruits being trained. They're being trained the right way. We need those good leaders. We need those chiefs, those sheriffs, those captains, those people to provide leadership. And when I was looking at that, I thought about a quote that I wrote down. I told you I've been doing a lot of reading, and it says, great leaders don't succeed because they are great. They succeed because they bring out the best in others. These young police officers out there are waiting for these leaders to bring out the best in them. Thank you for what you brought forward, Council Member.
And that's a really good point, and really relevant for the city of Bellingham, because we are very soon, or for the last several months, been seeking a new police chief in Bellingham. And so what we're looking for someone that will embrace these new laws and a positive change in policing. So we're definitely keeping our eyes on that. Okay, so next we've got a couple behavioral health specialists. We're going to start with Melora Christensen. She's a supervisor for Whatcom County's GRACE and LEAD programs. GRACE is the ground level response and coordinated engagement program, and LEAD is a law enforcement diversion program. And both of these are programs within Whatcom County. These programs work to divert low-level offenders from incarceration that may have a behavioral health challenge, or just people that repeatedly offend. Melora, if you could please describe the relationship you have with law enforcement and the impact these new laws have had so far on diverting people with behavioral health challenges from jail to programs that serve their needs. And a second part, what recommendations do you have for local policies to ensure public safety for everybody?
Yeah, thank you. And thank you for the invitation, and to the Riveters Collective for putting this together. I also want to thank the legislators for their thoughtfulness and their comments tonight, and giving us some perspective of where you were at last year, or last session when these bills were passed. I am a clinical social worker and have been working in Whatcom County for the past 10 years. Currently leading the Grace and Lead programs, in which we're serving individuals in our community that really slip through the cracks. Grace specifically serves the highest utilizers of emergency services, meaning they are the most familiar faces to law enforcement, to our criminal legal system, to our hospital emergency department, and to EMS and fire. And we do that by providing community-based services. So we go to our clients, we find our clients, and we try to address the root cause of that utilization. And really it comes down to the folks that we serve are in crisis. And so there's a few points. I'm going to take a little bit of a turn here and make it about mental health and our state. And I'm not going to sugarcoat it. But I do want to say thank you to the legislators for the work that you've done. But I will say that prior to COVID, prior to the summer of 2020, prior to all of this, our mental health system in this state has been just in dire need of reform, to the point that we have been piecing together as a community how we can support the most vulnerable people with persistent and severe mental illness, suffering from homelessness, severe trauma, extreme poverty, incarceration. And what's so amazing about Whatcom is that we've been really ahead of the curve. We've been doing collaborative work together. The GRACE program came out of a need to have collaboration with law enforcement, EMS, and fire to work together. So my staff work beside community paramedics. They work beside behavioral health officers and behavioral health deputies. And we've been, for the past 5 years, redefining what it looks like to address and support our community members that need it the most. What has been challenging in the last few months is that this legislation dropped on our community and our crisis system. We were not ready for it. I've spent more time trying to communicate the challenges of some of how this has played out in our community than I, and along with all of the COVID challenges that we have, we weren't prepared. And I know, Representative Ramel, that you had a lot of community conversations. But this bill, although I support strongly the intent of this legislation and these different pieces, it has created additional barriers for us to be able to support the people who are decompensated to a point. And I agree, there are lots of what has been passed that works, and there are these few little pieces, but some of those few little pieces, including involuntary detainments or ITAs, custody authorizations, has made it so that mental health providers and law enforcement officers who in the past have been able to get those people into a safe hospitalization, we are severely challenged by this. And I'm encouraged to hear Representative Goodman say that this is going to be addressed. I'm curious if that's going to be addressed from a special session or what we can anticipate. But I think as far as recommendations, my hope is that we can amend this legislation in a way so that we can get back to doing the type of collaborative work that we've already put in place, instead of trying for this community. I feel like, unfortunately, this legislation set us back because we were already out there. We were already talking about this new type of policing, this new type of community collaboration. And I agree that the timing of it, the fact that it went into effect, and I will just say a few things that we're hearing across the state is that there's about a 25% reduction in involuntary detainments across the state right now compared to last year, and some counties are reporting up to an 80% reduction. And that doesn't mean that people are not needing that. It just means that the response from law enforcement has changed. And it really has changed. If we had a representative from fire here tonight, they would tell you that calls are being transferred from law enforcement to fire and EMS is being sent out. And as a former housing provider and someone who's on the street doing de-escalation, ask any housing provider, shelter provider, mental health provider, there comes a point when someone is escalated where it becomes a safety concern. And at that point, you need the care team to include law enforcement. Right. And right now, because the language is not clear, law enforcement does not feel comfortable engaging. And that some of the unintended consequences that we're seeing is that housing providers are like Catholic Community Services and Pioneer Human Services are actually saying, do we have to change who we serve? And I know that that is a downstream unintended consequence, but it's something that would be so detrimental to the work that we've been doing here in Whatcom to house and serve the people that need it the most. So I could go into the weeds about a lot of this, but I will leave it there and happy to answer questions.
Crystal, can I respond just briefly to this? This is the most important issue right now, and that's mental health crisis and the role that police play in these crisis calls. We did not intend by any means to interfere with the great work police were doing with mental health professionals in the community. And yes, we will make sure that we explicitly refer to the Involuntary Treatment Act and the standards. We might even enhance the Involuntary Treatment Act to outline de-escalation tactics that are probably used now, but we could put that into the law. And so we want to make sure that quote unquote force can be used. Force sounds violent, like you're hurting somebody, but force could be just a matter of putting hands on someone, physically restraining them. And because of the concern that we have limited the use of force and didn't explicitly mention the Involuntary Treatment Act and these crisis calls, police are hesitant even to put hands on or to physically assist them to be transported to a secure facility for evaluation and so forth. Now, some police agencies have done extremely well. The city of Seattle responds to 900 crisis calls a month. And for all 900 of those each month, they use force 1.8% of the time. So about 98% of the mental health crisis calls in Seattle do not involve the use of force. So they really rise up to best practices, and we hope that police agencies across the state do that. But we do need the law to be clear that police may use reasonable force in those circumstances because that's going to help someone and not hurt them.
Thank you to the two of you and Melora for highlighting that problem. I can hear the emotion. Can hear that this is a really important issue for you, and it seems like legislators and behavioral health specialists need to be talking a bit more to make sure the wording is just right.
Crystal, could I jump in real quick?
Oh, sure. We're just getting more and more behind. That's great.
I'll be really quick. And Laura, I just want to say thanks for bringing this up and raising this point. And I would just add to what Rep. Goodman said. I think on the list of areas that 1310 needs to be more clear about, Involuntary Treatment Act is top of the list, but it's not the only thing on there. We need to make sure court orders more generally, it's clear. And on youth who've run away from home, we need to make sure that those circumstances are covered, even if somebody's not acting violently or a risk to themselves or others. We still need to allow law enforcement to be involved in those circumstances. So I think those things are definitely on the list here. And then the other thing I just want to highlight here. So this is an issue where it kind of falls into two of those buckets that I talked about, because there are things that I think we need to fix that are areas that are unclear or where our intention wasn't quite what we ended up passing. And then there's these other areas where I think there was this early message that this is going to mean police can't even respond to these calls. And because that's not true. That's the Attorney General has, I think, been very clear on that point in following up. And what we're hearing from leadership in police departments is that they are that their standing orders are now that, if we would have responded to a call before, we will respond to that call now for these behavioral health checks. But I think that message still hasn't filtered all the way down, and there's a disconnect between leadership and dispatch and the folks on the street. And So it's a matter of correcting sort of that whole chain of command.
Okay, thank you. I do want to keep us moving along. I think having some clarity there is really nice to clean that up. Tommy, we'd like to hear from you. Tommy McAuliffe is the supervisor or a supervisor with the Whatcom County's LEAD program, the diversion program, as I understand it. Tommy, if you could explain from us, what are some of the on-the-ground challenges you've seen so far when behavioral health specialists have worked with law enforcement?
Yeah, absolutely. And first, I'd like to thank the Rivers Collective for inviting me as well. So I think before I explain the on-ground impacts of the bill, I also want to provide just a brief synopsis on what the Law Enforcement Assisted Diversion Program is. And excuse the acronym, but I'm going to be saying LEAD just in terms of time. So the LEAD program was brought forward by Whatcom County Prosecuting Attorney's Office. And the purpose of the LEAD program was really to develop a collective among these traditionally siloed entities. We're thinking Public Defender's Office, Whatcom County Prosecuting Attorney's Office, Bellingham City Attorney's Office, as well as all law enforcement agencies within Whatcom County and CMAR Community Health Centers, who I'm employed by. And how we were trying to do really is collaboratively intervene in the lives of individuals who are really having significant interactions with law enforcement as well as the criminal legal system. And how my position plays a role in all of this is really I supervise 4 intensive case managers. Each one of those intensive case managers has a caseload of about 15 to 20 clients. And each one of those clients is really struggling with behavioral health issues as well as substance use issues. And what our job really is to go out, immerse ourselves within the community, meet those individuals where they're at physically and metaphorically, and then connect them to any individually tailored services that they see that are needed. It would help them reduce those interactions with law enforcement and the criminal legal system. Now, when I'm thinking of on the ground impacts of this bill and what we've really been facing, we're still receiving referrals from law enforcement, as well as we're still seeing engagement and collaboration with our program with law enforcement. But one thing we have seen a reduction of is our ability to collaborate with law enforcement in the field. Specifically, I'm thinking about conducting outreach and conducting welfare checks with law enforcement. We traditionally would collaborate with law enforcement in conducting welfare checks just to ensure there was a sustainable stability within our clients that are currently enrolled in the LEAD program and to ensure their graduation was expected and on time. But due to the fact that law enforcement can no longer conduct welfare checks unless an individual is in imminent danger, we're no longer able to collaborate with law enforcement as easily. And so this causes some significant barriers when we're out in the county, specifically in areas where we have no cell phone service. We're thinking Glacier, Maple Falls, Kendall, those areas that are very rural, but that we still see a lot of substance usage as well as mental health issues out there. And so that's kind of created some creativity needed and also a barrier for being able to check up on our clients. And also provides us with a little bit of an unease, essentially, when we're out there with no cell phone service and we don't have law enforcement as a backup in terms of being able to collaborate with them. So that's kind of what we're seeing right now in terms of the barriers primarily.
Crystal, could I just clarify one thing? And we did seek Attorney General's guidance on this, that first of all, welfare checks, the community caretaking function of law enforcement is entirely discretionary, always has been, and nothing prevents law enforcement from doing welfare checks, even if someone is not in imminent danger. The question is what happens when they get there. Perhaps the rules have changed. Once again, we will clarify that reasonable force, perhaps physical restraint or some sort of physical interaction, not hurting anybody, will be allowed in welfare checks. But I want to make it clear that the police can and should continue to do welfare checks and perform their community caretaking function. It's just that when they get there, perhaps they're unclear about what they're able to do and what they're not able to do.
I had a question for Tommy at the end of that, and I've forgotten it now. All right, so our last panelist, somebody had asked if we were going to bring any law enforcement in, and of course we did. We have Deputy Geraldine Clicks. She's with Whatcom County, and she's also a behavioral health officer, so she's kind of covering both of these areas, and we definitely want to get her perspective. Deputy Clicks, we'd like to get your point of view on the challenges you've faced with these new laws and the collaborative efforts you've had with behavioral health experts.
Well, first of all, thank you for having me on here. I'm really just happy to be a part of this whole conversation. I think it's a really important conversation for us all to be having. Also, you know, I think law enforcement as a whole supports the intent behind these laws. It's really the pen to paper that ended up being the roadblock for a lot of things, or the hurdle, if you will. So what I'm seeing is boots on the ground. I'm not an administrator. I'm not an elected official. I am the person doing the work every day. So I probably have a little bit different perception of things than the individuals that, you know, you all have been meeting with. So for instance, a custody authorization, that is a piece of paper that a designated crisis responder, who is a person that has the legal authority to go out and interview people in the field, and determine that they need to be held or taken on a custody authorization to the hospital for evaluation. That is a civil piece of paper. And traditionally we have 10 days to go out and locate the individual and pick them up and take them to the hospital. So one of the problems that we have with this legislation is that 10 days, you know, doesn't meet imminent. They don't go in and define imminent at any point in time. And so if a DCR goes out and evaluates someone and we don't have an imminent risk to themselves or others, we can't use any kind of force to take that person in. Force also was not defined in these legislative laws. So for some departments, force can be something as simple as putting handcuffs on a person. These people, you have to keep in mind, they're decompensated to the point where they're not going to go to the hospital willingly. That's why they're being evaluated by a DCR. And that's why the DCR, and I'm sorry, designated crisis responder. If I'm using acronyms people don't understand, please stop me because I'll get off on a roll. But, you know, the reason the DCR has gotten involved is because this person wouldn't go seek help. They're beyond that point. So now we have a situation where someone needs to be detained. They need to be taken in to get help. And we have laws that say that we can't use any force to get them there. You know, it'd be interesting to see what the local data is that supported the need for these laws and these changes, because a lot of it isn't a huge change to the way that we had already been operating. You know, I think Whatcom County was a great example of how we were effectively communicating with the mental health pieces of this puzzle. I mean, I might be thinking that we're awesome up here, but Whatcom County really is doing a great job of having our mental health providers, the GRACE program, the LEAD program. We are trying to be innovative in how we approach getting people with mental illness the help that they need. And so some of these laws that came out just felt like they actually took us backwards. We were making great strides. And I would say, you know, if you guys were to look up the statistics on our use of force, our significant use of force in Whatcom County, it'd be very low. So I had been taking notes while I went through here. I think the best way to explain this is through some examples of some people that I've been working with. So I have a gentleman, we'll call him, you know, John Doe. He had been in Whatcom County. He's a known schizophrenic. He was having an episode that the voices in his head were telling him that Black men were going to try to kill him. He ended up seeing a random person meeting that description, and he tried to stab them with a pitchfork. He was arrested, then he was let go. He's out on bail. He's not taking his medications still because he can't involuntarily be forced to take medications. While out on bail, he ends up calling 911 a whole bunch of times saying he's hearing voices. Some of them want to hurt him. None of these times would he want to go to the hospital. He did not meet ITA criteria. Finally, he arrives at the hospital. I think this was like 2 weeks ago, and tells the DCR and tells the mental health professionals, I need to be detained. I need to be medicated. I need to be detained. They call all over Washington state. They can't find him a bed. He gets kicked out of the hospital because they can't find him a bed. So part of the frustration that I have as a behavioral health deputy in Whatcom County is that we have, you know, the intent, and I could be wrong, and please correct me if I'm wrong, gentlemen, about the intent of this law is really to get the mentally ill and this vulnerable population a safe way to get help, and to keep law enforcement accountable for doing it safely. Yet, even if I can detain this person and get them to the hospital, or even if they're willing to go, there's not going to be a bed to keep them in. And we have people beating us out the door. And we really need to be focusing on how to fix these problems within our mental health system. Washington State, we shut down the entire civil side of Western State Hospital. And that's a problem. I mean, that is a huge problem. And so, you know, we're talking about alleviating police brutality, and I'm on board with that, but I also would like to see the data of how much that is occurring versus how much we need to be putting efforts into having these resources for these people. So, you know, I've got another example of a gentleman who just last month, we go up, he's up in Paradise, like Tommy was saying, there's no cell service. You have really sketchy radio service. I went up there with 4 deputies because of this recent law, right? One of the words that they don't define is, well, it doesn't need definition, but exhaust. So to actually put in the law that we need to exhaust resources, that pumps the brakes for a lot of people, because what does that mean? What does that mean? That's a huge word, exhaust. Is that, and also we, you know, the amount of time, sorry, it's as much time, taking as much time as necessary without using physical force or weapons. That's a direct quote out of 1310. That means, so for Whatcom County on a shift, we can have 4 deputies and a sergeant. If I'm up in Maple Falls with the gentleman who his wife calls in because he's having an active psychotic break, and she says, you guys got to get up here. He's walking around a yard. He's talking nonsense. We get up there. He's holding what turns out to be a training machete above his head. He's walking around. And we're looking at this going, there's 4 of us here and a sergeant and a DCR. The DCR looks at him and says, I'll sign a custody authorization because of the way he's acting and talking. That's great, but that's still a civil order. He hasn't broken a single law. We don't have probable cause for anything. We're here because there's a person in a very real mental health crisis, but there's no probable cause. And we can't actually articulate that he is an immediate or imminent threat to himself or others when he's just in crisis, if that makes sense. So he's walking around on his property with this machete, and of course, you know, I can speak for the Whatcom County Sheriff's Office. That's all I can speak for, but I have never been on scene where I have been like, oh my gosh, that was an insane use of force. I have complete faith in all of my fellow deputies. And so I have my taser out, but we're not there for a crime. And I know that. And it's along with saying as much time as necessary without using physical force or weapons. and leaving the area if there is no threat of imminent harm and no crime has been committed, is being committed, or is about to be committed. So the way that law enforcement works is we rely really heavily on case law. So case law and the reasonable officer standard, but these legislative changes are changing that standard. And I know that I can't keep this within 5 minutes, so I'm sorry. I'll try to wrap this up, but I'd love to have a whole other conversation. I would love to really dive into this and explain why boots on the ground see this as such a problem, because along with all of this change, you then go over to, look at House Bill 1054, which they already addressed, where Whatcom County does believe that the .50 caliber or greater is a shotgun round, which is a beanbag round. So when this got signed into place, we lost a very useful, less lethal option, which essentially, besides the taser, was our only less lethal option. And tasers have a very low percentage of actually being effective. So, there's just so much going on. And then you've got the whole part of any individual. When we talk about House Bill 5051, and you go to section 12, and they have now changed it to any individual may submit a written complaint to the commission stating that an officer's certificate should be denied, suspended, or revoked, and specifying the grounds for the complaint. So we've totally changed the way that we've been operating prior to this, and we've included that a simple complaint could turn into something as big as losing your certification. There shouldn't be any surprise that law enforcement across the board are saying, hold on, if this isn't a crime, the way this legislation all pulls together, while it's not specifically listed, really would leave a reasonable person to believe that the intent of the legislation was to basically have law enforcement not go to anything that's not criminal, which I also could be on board with. But we do need the public to realize that, and we do need the legislators to come out and specify, or the Attorney General, what is the intent of all of these 12 bills together? What is it that the public wants from us? Because right now it just feels very uncertain. And that's part of the reason that you're seeing a lot of this hesitancy. And hopefully that makes sense. I know that there's probably a lot more going on in my brain than words coming out of my mouth, but it's I don't believe, Mr. Ranmel, I don't believe legalizing drugs is playing a part of it. I know it's not for me when it comes to my hesitance. I've never been on the drug task force. It's never been my jam. I truly have a heart and a desire to work with our mentally ill population. I love working with Grace and Lead, and I love that I feel like I have a true position here in law enforcement to try to be the one to show the whole story and really get people involved, because law enforcement ends up being sometimes the first people to recognize someone with mental illness and to be able to get them into the steps that they need to start to get better. And so now to have it where literally it's telling me to leave the area instead of use physical force if there's no threat of imminent harm and no crime, that's a lot of people I work with. And does it make sense to leave rather than be able to get this person help? That's I've probably taken enough of your time. I could keep going.
Thank you, Deputy Clicks. It is important to hear your day-to-day and what you're dealing with. We have definitely gone over. Our 35-minute Q&A is now 5 minutes, but we'll try and squeeze in a few questions. Been monitoring them.
Crystal, I just wanted to clarify a couple of things that Geraldine said, the legislation does not require officers to leave the scene. The way it's constructed, and maybe perhaps it is confusing, the way it was written, leaving the scene is one of many options, of many de-escalation tactics. So there's absolutely no requirement whatsoever that an officer leave the scene if there's no crime being committed and there's no imminent threat of bodily harm. We listed a whole bunch of de-escalation tactics, one of which is leaving the scene. Before we passed these laws, there are a number of circumstances where police would show up and it would be appropriate for them to leave the scene. There's like, well, there's nothing going on, let's leave the scene. And so that sort of remains, nothing changes there. We did not, however, define imminent clearly when it comes to the use of force. We do define imminent when it comes to the use of deadly force in another section of the law. And I do believe we should define what imminent means more clearly so that police can have certainty there. And then the question of what force is a question we have asked of the Attorney General, and they will be coming back with an answer to that question for certainty there. But we laid out a non-exhaustive list of de-escalation tactics. You don't have to exhaust all of them. And we also said, if possible, exhaust them. And so we're leaving discretion to law enforcement to do what they did before. What we just wanted to make sure is that they're not using force unreasonably or excessively. And finally, I want to comment that Whatcom County is nationally recognized in the great work that you're doing. I am chair of the Law and Justice Committee for the National Conference of State Legislatures, and I have been on a couple of visits, actually conferences with the National League of Cities and National Association of Counties. And Whatcom County folk came with me. We were in San Francisco and we were in Philadelphia with national meetings. And Whatcom County is doing an awesome job. The GRACE program and LEAD and the City Council and the County Council. So I want to give you credit for really being a model and a showcase for the nation.
Oh, I would really love to get a few questions in.
30 seconds. I just wanted to say, I 100% agree with what Roger said about the recognition that Whatcom County has and the reputation that it has because of Melora and Tommy and Geraldine and your teams. And really appreciate that and recognize that you've been caught in a tough spot because of this. And that's something we have to fix, and we're committed to making that clear. I think a lot of it goes to that first question we got of making sure that model policy comes out so that we can dispel some of the uncertainty that we're hearing from you and have heard from others as well.
Okay, thank you. We'll move on to our very brief Q&A. And one of the comments that I see pop up is Stephen Jackson mentioned that it seems like law enforcement is purposely misinterpreting the legislation. And I know that's certainly a concern. I want to switch off of use of force because it seems like that while it's a good discussion for us to be on, I don't want to only be talking about that. I'm not sure, maybe one of the legislators are best to answer this, but the Riveters really love the idea of a public data dashboard, and somebody posted the question asking, I know there will be a use of force data dashboard, but are there plans to broaden that? Our committee has been trying to get information from the city of Bellingham, and it's really been a very excruciatingly difficult process. I know there are open data sources like the Police Data Initiative that cities can and counties can sign up for. Do some of these bills that we might see next session extend the publicly accessible data portion of that? And if we can keep it brief, that would be great.
I'll comment briefly. Representative Lovick was the sponsor of this legislation in the House. We have set up a consortium within the Attorney General's office of universities, private entities, experts in building databases related to police interaction with the community. We're starting with the use of force. Use of force databases already exist, a number of police agencies already in the state, because again, they want to diagnose their practices and improve. So for instance, in Spokane, this is a number of years ago, they found too many dog bites, too many injuries from chokeholds. So they adjusted their practices. Dogs are no longer off leash. By the way, we've also established a canine working group within the Criminal Justice Training Commission to make sure that statewide we have policies related to canines so that we're not harming people and yet using canines to advantage of law enforcement. Use of force is starting right away. Also, deaths or injuries in custody is another data item. Then we can actually build a database of arrests. That's actually pretty easy because that's already reported. It's public information, so we can see who's being arrested and all the demographic breakdown there. We can expand it further to not searches. Searches are tough. Searches are, you have to dig through each police report, but stops we can track pretty easily. There's two types of stops. There's those who are when the officer is dispatched to the scene, and there's those officer initiated stops. We're actually more concerned about the officer initiated stops because there might be bias there, but that also is captured in the police reports. And artificial intelligence allows these written or typed reports to be just fed into a computer and it comes out in a database. So we have the technology to do that. And then use of force is sort of, well, use of force is really the first thing we're going to do, but we've already set this in motion so that we're going to have databases related to many different types of interaction between police and the community. And that will continue. If there's more input, like we need more data, then we'll just build that in. Microsoft is participating, and Seattle University, Washington State University, and a number of other firms that specialize in this. So it's really all the experts coming together.
All right. I'd like to get one other quick answer to a question here that a couple people would like posed. Is it true that the behavioral health position within the BPD is ending at the end of the year? What will happen to that budget line item, and what's the plan for addressing ongoing mental health needs in our community? That sounds like a long answer, but maybe you could just answer the, is that position ending at the end of the year? Maybe Councilmember Huffman, do you know about that?
I do. I just heard about it yesterday, so I don't have any information more than that.
Okay.
Yeah, it's true that the behavioral health officer position is being suspended, but it's due to staffing shortages. So all of the specialty positions in Bellingham Police Department are being cut to keep enough officers on patrol. So we hope that when they are back up to fully staffed, that we would be able to reintroduce the BHO position and expand it. We've been trying to expand it, but due to various circumstances, the BPD is having significant staffing shortages.
Representative Lovick actually championed the legislation on the state level called the Behavioral Health Field Response to establish a grant program to provide the funding to local police agencies to do this, co-responding and mental health professionals side by side with law enforcement. So I hope it's not an issue of funding, but as Melora said, it's not enough trained professionals to do the work.
Yeah, and I mean, this has already been mentioned, but we really do have a severe work shortage for behavioral health professionals across the state. And although there are new funds for this type of work, for example, I've had open positions in the GRACE program for many, many months, and I'm unable to recruit. And so it's something that could be taken up at the state level to be able to create programs where we're building our own workforce here locally.
Okay, that wraps up our very brief Q&A because I do want to make sure that we hear from Nakia Hunter. This evening wouldn't be complete if we didn't hear from someone impacted by police violence. Nakia Hunter's brother, Carlos Hunter, was shot fatally by by Vancouver police in 2019. So this is all still very fresh. Since that event, she's advocated for police accountability legislation. She works with the Washington Coalition for Police Accountability to help pass laws. And she also chairs the NAACP legal branch. We've asked her to come tonight to share her story, provide some insight into the importance of new police reform laws, including how they relate to the killing of her brother by police. And we're hoping that she can just give us some insight into some laws that they're hoping to pass in the upcoming legislative session. Nakia, thanks for joining us tonight.
Hi, thank you for having me. I'd like to thank the panel prior for great education and the Riveters Collective for having me. My name is Nakia Hunter, and I am here to tell you about our mission and my story. My brother Carlos Hunter was tased 4 times maximum voltage and then shot 16 neck to groin while seatbelted in his vehicle in a flanking maneuver by 2 detectives of the Vancouver Police Department. He and 6 others lost their lives in the most violent forms since I-940 was enacted statewide. The Washington Coalition for Police Accountability is unique among those involved in police accountability work at the Washington State Legislature, and perhaps unique nationally. We center families who have lost loved ones to police violence and who have experienced the consequence of police use of unnecessary, excessive, and deadly force. The coalition's direction is set by those families, and the priorities are directly related to injustices encountered by these families. Our mission is to develop and advocate for statewide policies to reduce police violence and increase accountability. In addition to the leadership of impacted families, the history of race and policing, and the impacts of discriminatory policing on Black Americans, Native Americans, Latinos, Pacific Islanders, and others, underlines all of the WCPA's work. When we as communities and Washington State as a whole see nothing wrong with where the bar has been set, holding law enforcement accountable for violating the right to live equitably and safe, even when you make poor choices that may leave you a criminal, be it as it may, whatever the circumstances, court should never be held in the streets at the judgment of our peace officers, treating people inhumanely, and then deciding it reasonable to kill them. This is the United States of America, not a third world country. There's no excuse to treat human beings in this manner. What we have allowed to be the standard, the norm, is unacceptably unthinkable. The collaboration among city officials, chiefs, and sheriffs to keep the communities operating in dated policies and military-style policing, pushing the pipeline to prison with no rehabilitation, creating community fear to gain political footing, refusing to support other divisions, mental health units, etc., because of the new laws that offer a sliver of a start towards real change that holds the violation of officers and departments and city officials accountable and makes the chance of repeat behavior impossible. These new police reform laws were drafted in blood, carried across the line with no hidden agenda. Since July 25th of 2021, across the state, many man-hours by guilds, unions, and police departments have been spent structuring just how far limits can be pushed, creating false alarms among communities, pushing for and inciting refusal to conform to the new standards is how some of the officers have chosen to respond to the community's demands for accountability, equitable policing, and transparency. Resisting community control is all we see in some areas. Why is it so hard to understand that the less lethal to us families that have had our loved ones slaughtered in these misguided reindeer games is shoot to wound, to stop, use force that doesn't kill, judgment, just the same as when apprehending white individuals who have broken the law the same, killed, harmed, or displayed violent actions towards the police and the communities in large. These accepted standards of care are no longer acceptable. We want a commitment to equitable, transparent, accountable policing for every human being statewide. That is why we do the work. Thank you for allowing me to put our truth into your hands. And hopefully, as you move into the next legislative session, you can understand that we didn't draft these bills to make it harder for the mental health communities to receive help. We wanted to structure it to where the other parts of the communities are strengthened in our ability to make it home alive, in our ability to not end up burying our loved ones. Our next session is designed to strengthen where we may have not fully seen the impacts that the laws might have had on the community, as you've all spoken about tonight, to work on the traffic stop issues for minor offenses. And there are a few, and I apologize, I do not have my notes on them up. But if you follow the WCPA on Facebook, it stays up to date and informative. The NAACP Vancouver branch 1139, you can also find a lot of informative things for that community area, as well as I'm sure all of your community organizations are trying to help navigate through these changes and in order to safely strengthen our communities. Together, we can make the changes that need to be enacted to save all lives. Thank you for having me.
Thank you, Nakia. It's really important to hear what's been happening to families and individuals across the country and in our state too. I know Vancouver's been a hard hit area. That ends our evening. We're roughly on time. Thank you to all our panelists and Nakia for your time, interest in the topic, and your dedication to trying to improve policing and just to be there for everyone that needs it. Thanks also to the Riveters board members and committee members for working behind the scenes. Tomorrow you'll receive an email asking for your feedback and any questions that you have. We will try to sort through those and see if we can put them in categories and maybe try to post some answers, get some answers for some of those, because we did have a pretty short Q&A session. I apologize for that. I had a hard time reining you guys in. It was a lot of good information tonight. And then we will also post the recording for the webinar soon. It will come out in all of our normal ways through Facebook, our monthly newsletter, and also through email. All right, well, that's it for everybody. Thanks again, and everybody stay safe, please. Thank you.